2, 3. Let's go. Arise, O compatriot, Nigerians call, obey, to serve our fatherland with love and strength and faith. The labor of our heroes past shall never be in vain. To serve with heart and mind, one nation bound with freedom, peace and unity. Thank you very much. You can have your seat. Thank you very much once again. I want to appreciate everybody who has taken out time out of their busy schedule to make it out for today's August occasion. I still stick by it. For those of you meeting me for the very first time, my name is Odigwe Chukwuka Ebinum. But for convenience, you can call me MC Chooks and be the compare for today's occasion. Right about now, I want to quickly introduce very, very important dignitaries in our midst. I'm sure if I don't do this, something very good will happen. Distinguished ladies and gentlemen, please, already seated is the Minister of State for Health. Distinguished ladies and gentlemen, please jam your hands, especially for Dr. Osage Ihenire. God bless you, sir. God bless you. Very gentle and humble man indeed. Okay, thank you for honoring us with your presence, sir. We appreciate. Distinguished guests, ladies and gentlemen, please also here with us, we have the President, Global Business Coalition in Health, GBC Health. She is Miss Nancy Wild Fairfield. Is she in the building? God bless you. Okay. We also have here present the head of Sustainability Access Bank PLC, Mrs. Omobolanle Victor Laniyo. Thank you. Here present also, we have the technical advisor to the Minister of State for Health. He is Dr. Shuaib Belgori. God bless you for coming, sir. We also have here with us the World Health Organization representative. He goes by the name Dr. Tolu Arowolo. Oh, I'm sorry. It wasn't specified, so maybe. Okay, she. Also here with us, we have CEO Aliko Dangote Foundation. Forgive me. CEO Aliko Dangote Foundation, Miss Zura Yusufa. Oh, Yusufu, I'm sorry. Yusufu, Mrs. Zura Yusufu. Please, ladies and gentlemen, celebrate her one more time. Thank you, Ma. Thank you for the correction. Okay, straight into the business of today. We are going to have the welcome address. We're going to have the welcome address, and the welcome address is going to be led by the head of Sustainability Access Bank PLC. Ladies and gentlemen, please, one more time, help me celebrate Mrs. Omobolanle Victor Laniyo.
Thank you, Chooks. Good morning once again, and I would like to apologize that we're starting a bit behind schedule. The Honorable Minister of State for Health, Dr. Osage Ihenire, the President, Global Business Coalition on Health, Ms. Nancy Wild Fairfield, the Special Technical Advisor to the Minister of State for Health, Dr. Shuaib Belgor, the CEO Aliko Dangote Foundation, Mrs. Zura Yusufu, representatives of various corporate organizations, CAMA members here present, members of the National Malaria Elimination Program, gentlemen of the press, ladies and gentlemen, I would like to say a very big good morning and welcome to this private sector session that is focused on accelerating investment to bring malaria to zero. Defeating malaria is absolutely critical to ending poverty, improving the health of millions, and enabling future generations to reach their full potential. According to WHO World Malaria Report 2017, which I find very interesting, and the key partnership frameworks that we need to establish in order to improve public-private sector partnerships. The discussions and activities of today, I hope, will truly shape strategies and actions that will drive increased impact and accelerate progress in the national efforts to eliminate malaria in and as we work together, sharing best practice and strategizing on how to create new partnerships and record progress in our malaria control efforts across Africa, I can only wish us the best. Thank you, and I wish us a productive session ahead. God bless you.
Ladies and gentlemen, in this regard, I also want to bring somebody up to give us some other introductions. She's coming from another perspective. Distinguished ladies and gentlemen, President GBC Health, ladies and gentlemen, please jam your hands together for Miss Nancy Wilder-Field.
Thank you so very much. Good morning, Honorable Minister, ladies and gentlemen, friends, and dear colleagues. I'm honored to speak to you today on the occasion of the CAMA Private Sector Malaria Forum. And as I look out, if I pull my glasses down a little bit, I can see more clearly. I'm pleased to see so many great partners here today. And let me say a special thanks to Belanle and to Access Bank, Belanle for your warm and thoughtful welcome, and to Access for hosting us here today, and personally to add a special thanks for the care that the title for today's forum is Accelerating Investment to Bring Malaria to Zero. And it's true that investment is sorely needed. Funding for malaria is only at 41% of the 2020 target of $6.5 billion. And as you've heard and we will continue to reinforce through today's session, almost half of the world's population is at risk of contracting malaria, and the disease remains a major public health challenge, especially here in Africa, which bears 90% of the global share of malaria cases and 91% of malaria deaths. We want to change that. Nigeria accounts for the highest number of cases and deaths from malaria in sub-Saharan Africa, and the economy itself loses approximately $1.1 billion each year due to malaria-related absenteeism in the workplace and treatment costs. Yet while challenges persist, significant progress is being made. Since 2010, there's been a 35% decline in the number of children under 5 testing positive for malaria. 69% of families own at least one insecticide-treated bed net, and more than 1/3 of pregnant women took the recommended preventive therapy. And I'm sure the Honorable Minister will address this in a little bit more detail. Investment is vital. There's a strong rationale for the private sector to play a role in shaping health markets in Africa, and in particular in malaria, with its direct impact on the workforce and communities. Good health truly does mean good business, and investing in health is both a business and a social imperative. Companies continue to lead in supporting regional and national health goals through workplace health and wellness programs for employees, dependents, and communities, direct service delivery, improvements to data management, supply chain monitoring, training of health workers, and/or other supportive inputs, and influencing policy that helps to improve systems and increase domestic financing. On the supply side, there's a strong appetite from both the global and African business sector, philanthropists, donors, and development partners for investing in innovative and scalable health systems and solutions. And in fact, we're launching a report in investment in the fight against malaria. All of you are in the room today because you believe in and understand the importance of working together to fight what can often be a fatal disease. Yet outside the room, Africa is undergoing a massive demographic change. 70% of the continent's projected 1.6 billion inhabitants will be of working age by 2030. The youth bulge will no doubt change the economic landscape of the continent. Harnessing this potential into positive force for development through investments in health, empowerment, education, and employment is one of the greatest challenges in the next 15 years. Make no mistake, private sector is an essential partner in the fight to leave no one behind. Our hope is that this meeting is not the end, but the beginning of a better coordinated action and achievement on malaria. The coming years will be a period of great opportunity for business to contribute to our joint efforts to address system challenges and continuing commitment to education, prevention, and treatment of the disease. We call on business and corporate leaders across the continent to join us to create a malaria-free and healthy continent. Let's work collectively to ensure talk leads to action and action leads to impact. Impact that not only saves lives, but also improves business productivity and stimulates economic growth across the continent. Thank you.
We have an opening remark. And she's here. An opening remark by the CEO, Aliko Dangote Foundation, Miss Zura Yusufu. Ladies and gentlemen, I got it this time, please. All right.
Thank you, Chubbs. Good morning, everybody. Standing on all observing protocols, I still have to say hello to the Honorable Minister. But all protocols observed for everybody else. Please forgive me. When I think about what it took for, say, Italy to overcome malaria, or the US, right? These aren't places that we think of as malaria infested anymore, but they had it. And what it took was a combination of policy, the government, the private sector, civil society, the medical community, and citizens coming together and working together to end malaria, and they were able to do it. I read this book about how Italy was able to overcome malaria. And so it gives me hope that we can do the same thing. At the Aliko Dangote Foundation, we have been focused on malaria for quite a few years. Alhaji Aliko is the UN Malaria Ambassador for Nigeria. And what that means is that he's supposed to use his voice, his resources, and his time to help us move towards the end of malaria. What we've been doing so far over the past, I would say, couple of years since I've been around is really to look at how do we then use our voice and use our convening power around the private sector to make sure that other companies are doing exactly what CAMA is trying to do. How do we help end malaria? What do we do? One of the first steps that we took after writing the private sector engagement strategy, which we did for NMEP, which is the National Malaria Elimination Program, was to have our own internal program, right? So you have to start with yourself. As a company, we have over 30,000 employees. What are we doing as a group to make sure that our staff and our stakeholders are covered and taken care of when it comes to malaria? So between education, training, rapid testing, access to malaria drugs, spraying the what's it called, indoor residual spraying. All those kinds of activities that we need to take as a group is what we're doing. So yesterday we had our own World Malaria Day celebration, and I see one of my colleagues here who's even wearing the t-shirt that we had. A lot of this we're doing in collaboration with GBC Health. So thank you very much, Ochuko, and thank you, Nancy, for the partnership. Of course, Access Bank, our friend from my entire experience in Nigeria, which is long now. And so what I really wanted to say as in terms of opening remarks is let's really think about what we can do. We know what we're trying to do. We know how we're trying to use our resources and our time and our energy and our voice to try to really take home the message that malaria is killing people and is costing us economically. So you've all heard the statistics: 445,000 lives lost, 285,000 children under 5, all in Africa, dead. 29% of the global disease burden of malaria is right here in Nigeria where we live, meaning that out of 100 cases of malaria in the world, 30% of them almost are here in our one country. So this is really what should we do? So I'm really happy to be here today. I'm looking forward to the deliberations that are going to happen now, and really looking forward to hearing the commitments that the Honorable Minister is going to make, and hear what are we all going to do collectively. So thank you very much for all being here, and I'm really expecting us to have a very engaged day. Thank you very much.
So, this is the remark of the National Coordinator, National Malaria Elimination Program, Dr. Audu Bala Mohammed, on state of malaria in Nigeria, challenges, opportunities to engage private sector at a forum organized by the Corporate Alliance on Malaria in Africa, CAMA. Malaria constitutes a huge epidemiologic burden in Africa and continues to cripple economic activities in the region. In Nigeria, the disease is responsible for 60% of outpatient visits, 25% of death in children under 1 year, then 11% of maternal death, and 30% of childhood death. The financial loss due to malaria annually is estimated to about 132 billion naira in terms of prevention, treatment costs, loss of man-hours. The National Malaria Elimination Program is domiciled in the National Malaria and Vector Control Division, which is a division in the Department of Public Health or the Federal Ministry of Health. As a national program, it comprises of malaria control activities at federal, state, local government, and community levels. The private health sector accounts for at least a third of 34,000 health facilities in the country. Over 60% of the Nigerian patients with a fever seek initial treatment from privately owned health establishments. Since a large proportion of patients with malaria are treated with the private sector, improving the quality of malaria treatment through private pharmacies and drug shops is very critical. Finally, the private sector has great opportunities for investing in highly rewarding areas. Through engagement, gaps in demand are discovered and can expand the business of private sector partners. This is true for supply of long-lasting cesarean nets and the establishment of pre-qualified factory for ACT tablets. We have a company that is manufacturing those nets now in Nigeria. So there is also an opportunity for corporate social responsibility. Thank you very much for listening.
Ladies and gentlemen, please quickly help me celebrate one more time Miss Nancy Wildfare Field. She's coming to talk about the Global Fund. Please celebrate her one more time.
The Global Fund to fight HIV/AIDS, TB, and malaria, and business leadership convened by our organization, GBC Health, and others. We have reduced mortality from malaria by more than 50% worldwide. This effort has prevented millions of premature deaths, untold human suffering, and saved precious resources in countries heavily affected by malaria. Children have been able to develop their full potential, and mothers have had to spend less time at clinics and more time in productively participating in their societies. The Global Fund provides more than 50% of the international funding towards malaria. During the period of 2002 to 2016, it dispersed in excess of $9.1 billion in malaria control programs in more than 100 countries, using a comprehensive approach with international funders such as PMI and other bilateral donors, which combines education, prevention, diagnosis, and treatment. Gradually, international funding is also leveraging increased domestic funding for malaria. The Global Fund is progressively using co-financing mechanisms to ensure that donor contributions to fight malaria are matched by countries' own contributions. Co-financing commitments linked to $355 million of donor investments through the Global Fund have helped catalyze $2 billion of domestic investments in 46 countries affected by malaria for the period of 2018 to 2020. However, the last World Malaria Report published by the World Health Organization provided some sobering news. For the first time in many years, the number of malaria cases worldwide went up, not down. In 2016, there were an estimated 216 million cases of malaria, an increase of approximately 5 million cases over 2015. We still have to better understand the underlying reasons, but it seems that it has been a combination of several factors. Challenging political environments in some of the most affected countries, increasing drug and insecticide resistance, and possibly the beginning of the effect of climate change on transmission patterns. Another major factor is the lack of financial resources. While the funding has gone up significantly, there is still a major gap, and the world would need to spend almost double the amount from what it is spending today. These resources will have to come predominantly from domestic health budgets, but they need to be complemented by international solidarity instruments and the private sector. Only together will we be able to drive down the number of malaria infections, reduce mortality further, and finally end malaria, as stated in the Sustainable Development Goals. Most of all, we need full political commitment by government and global leaders. Fortunately, we have just seen this expression of political and financial support coming from the highest levels. Last week, I attended, together with many others, the Malaria Summit in London and the UK. We saw unprecedented attendance of heads of state and governments from many Commonwealth countries pledging their full support to the malaria elimination agenda. Bill Gates pledged another $1 billion over the next 5 years, investing in much-needed research into innovations that will provide new tools for diagnostics, treatment, and a refinement of the first malaria vaccine. The Minister of Health of Nigeria pledged an additional $18.7 million in malaria funding from the federal budget, and many other ministers followed his example, pledging new resources. We applaud the Honourable Minister for his commitment. The UK government pledged £100 million as malaria matching fund channeled through the Global Fund. At the last Global Fund replenishment, the UK used a similar mechanism to leverage support from the private sector to fight against malaria. At that time, the UK pledged included a commitment to double private sector contributions for tackling malaria, up to a maximum of £200 million. That match was successfully met in 2017. The new commitment will match pound for pound private sector contributions to the Global Fund to fight malaria up to 100 million pounds. The Gates Foundation has already generously agreed to support the match fund with a 50 million pound contribution, and the Global Fund will fundraise for the remainder. The private sector can make a critical difference in many different ways through their research and development, developing new and innovative products, and through innovative ways in the implementation of malaria programs. Project Last Mile, for example, is a public-private partnership that applies Coca-Cola's supply chain management and marketing expertise to support African governments in reaching the last mile to deliver life-saving medicines and supplies to the hardest-to-reach communities. And finally, through providing much-needed financial resources complementing government funding where required. That is the private sector he's referring to. We invite companies to join us in implementing the UK Matching Fund or to finance malaria programs directly in countries and regions of their interest. I would like to wish you a very productive conference in recognition of this year's World Malaria Day, and I want to assure you that the Global Fund, alongside GBC Health and others, will remain your partner, making sure that we mobilize together the necessary resources to end malaria and implement programs that will not only save additional millions of lives, but enable the world to finally declare victory over a disease that has ravaged humankind for far too long. Thank you on behalf of Dr. Christophe Ben.
Called on ExxonMobil, Dr. Adekunle, to share with us what are some of the challenges to fostering public-private partnership in Nigeria. Many times we are already on a forum. People talked about public-private partnership. Is there a framework you can share that you think can work for us to be able to help at local level, at national level, at regional level, especially for the malaria fight? ExxonMobil is doing a lot of great work in supporting non-governmental organizations, civil society organizations, and private sector to boost the malaria fight. What can you share with us about partnership framework or what we need to do to foster PPP in Nigeria?
Yeah, thank you, Dr. Olo. Standing on existing protocols, the first thing we're talking about, the challenges to fostering PPPs in Nigeria. I think as a Nigerian, you know that the first issue we have, the first challenge we have is distrust. We have a history, things have happened in the past, and when private organizations come into programs, they are very careful.
I want to give the also opportunity of asking him questions. We've listened to his keynote address, and I know we are burning to ask one or two questions from him. So one, can I have one more? Okay, two, great. Yes.
My name is Dr. Akinfa Jola. I'm Regional Community Health Manager for Shell Nigeria, and I'm excited to be here today. I'm really excited about the diverse team that is in the house, and excited that our Honorable Minister is also here. I listened to him attentively and really excited about the stepwise approach in which he highlighted a lot of things that the government is looking at and the supportive collaboration from the private sector. Once again, I don't know whether this is actually a question to the minister, but I think it's just food for thought for all of us. Because Dr. Adekunle mentioned some principal things that are very essential for us if we really want to deal with the malaria battle. And the minister asked us that are we really ready to beat malaria? I think for us, Dr. Adekunle highlighted a few things. And I just want to piggyback on a few things that he had highlighted and for the minister to take some of these things for us to be able to work together. One, I think the private sector needs to bring together its complementary strengths. We have different strengths and we can use that.
All right, thank you. The Honorable Minister of State for Health. All protocols duly observed. My name is Yetunde Olarewaju. I'm from the Global Alliance for Improved Nutrition Gain. In your speech, sir, you mentioned something about nutrition, especially for under 5 children, helping them to build antibodies against diseases and malaria that we're talking about today. And interestingly, I've heard all the opening remarks, the welcome speech, but except for it, I've not really seen where these nutrition interventions can really help to eradicate the malaria that we want to do. So I want you to elaborate. Is it that these nutrition interventions are not really necessary to eradicate malaria? If it is, how do we bring this nutrition component into the CAMA's fight to eradicate malaria in Nigeria? Thank you, sir.
Well, thank you very much. Let me start with the last speaker. I did say that I like the idea of the group that was presenting an integrated approach by adding nutrition. You'll notice that in the chart they showed us, the highest prevalence of malaria was in the northeast and northwest. And that's where we also have the highest prevalence of malnutrition. So, is it coincidence? So we don't know. But then, of course, those areas are different because the Sahel area, the 9 states we have in the north, which have seasonal malaria, because during the dry season, they don't have malaria at all. So they have very low residual immunity. And when the rainy season comes, they get malaria usually much worse than we see in the south. So they have a lot more terrible cases. So, yes, the strategy to improve nutrition cuts across everything, including all diseases, whether it's tuberculosis or whatever. You still need, and in fact, stunting is higher in those areas too. So you didn't need that for development, for mental and brain cognitive development. So if you're able to do something about nutrition, you have covered a lot of ground. But one thing about nutrition is that a lot of it is not because of lack of food, it's ignorance. So we are talking about education. There are people, women who have the food there, but they don't know that that's what works. They give akamo because it looks like milk, and then they withhold the meat and the protein. So education is a very important part. And that's where, again, the health system comes in, the primary healthcare system, where you have well-trained community health workers, capacity building, who are trained to also educate the people on behavior change and social changes. And that will include hygiene, environmental sanitation, personal hygiene, domestic hygiene, and nutrition, better in nutrition. Of course, there are areas where there's hunger, where people just don't have enough, where then support is necessary from government and partners. So the entire picture is taken care of by the health system. The way the health system is designed, the primary health care is fixed, and there are supposed to be outreaches where you have community health workers who go out to the communities actually. And if you know what happens with malaria cases, if somebody has malaria in the evening, if you don't take care of it within 24, 48 hours, it's looking very bad already. And because it might be because they didn't have a transport. They didn't have transport. But if you had someone in the village, community health worker who could recognize immediately that that's malaria, you save a lot of time. Time matters in managing malaria. So access to treatment is a problem. If they have to drive to the general hospital way, that they probably don't have a transport for that, or the fare, that's different from if they have to walk 1 mile to the nearest public health center, a primary health care center. So those are things which are all part of a pattern. The sustainability, yes, I do agree with you. When you have a pool fund which is supposed to take care of a problem, you have to create a management structure that is going to run it the way you want, according to the pictures you set. This government here has put particular emphasis on working in the private sector. And I think it was Nancy I was talking with today who said they've seen changes, because there's a lot of emphasis, not only at this level, but even at a higher level. We're encouraging investors to come in into our hospitals. If you want to if you want to bring in a radiotherapy machine into a teaching hospital and run it yourself and operate it, we pay for services. So the government doesn't have to bring in MRI. If you want to do that, you can put an MRI into Luth, and then you charge. So we're looking for private money. We're looking for private expertise. You run it, you maintain it, you manage it, you bring in your own staff. So we're looking for real engagement from the private sector. Now, even in management, you have a pool of funds. You can take part in management. You can know what's done with it. We will not take it away and tell you to go and sit down. You can be part of the governing structure. But if, for example, you know that the program runs 10 years and you want to be part of it only 3 years, that's what you plan, it doesn't mean you can still go in. And by the time you leave, maybe by the end of the third year, there are other organizations and groups that find it so attractive, they join. So some go and some will leave. Some will leave and others will join. But the important thing is that if it is managed well and if it is attractive, there'll be more people trying to join than to leave. And by that, it's going to be sustained to the end of its life. Right now, we are looking at malaria to be up to 2030. If we are lucky, that's when your target is. So if ExxonMobil can run along with 2030, then that's fine. But if your plan is to reach 2020, well, as you come out, encourage Chevron or some other company to take your place and join in the pool of funds so it doesn't run dry, it doesn't die before its time. So those are all part of the things that we want to be able to address. I spoke of a document that was generated, private sector engagement with government. Government, of course, has a strategy, wants to be able to be the focal group in there, but is definitely willing to take your expertise from private sector, your knowledge, your efficiency that goes with you, your management style. We want to bring all of that on board because we want to be able to cover more miles with the fuel we have than we were covering before. We want to be able to do more than we were doing. We're looking for efficiency. So the engagement of the private sector is very welcome, and not only engagement, but also the participation, and in many cases also even leadership. We can surrender to you in any particular program you are interested in.
Memorable event. Thank you to the Minister of Health. He has been so patient. He came all the way down from Abuja yesterday and has been with us. Thanks to the dignitaries in the room, and we are very appreciative of your presence. We have a very important document today that we want to launch and tag the Corporate Action on Malaria Best Practices and Guidance. For the past decade, the Corporate Alliance on Malaria in Africa has mobilized business action on malaria, recognizing that the assets of the private sector are a valuable resource in the fight to protect employees, communities, and consumers from malaria. Today, CAMA members are leading. You can see what they're doing. The video tells it all. They're showcasing what they're doing, and they're actually at the forefront of the fight against malaria, starting from the employees, from the communities where they work, and the world at large. They are putting so much funds, even in kind and in cash, to actually get us to where we are right now, supporting the government to ensure that we have a malaria-free nation and a continent. So companies featured in these publications are paving the way for broader private sector engagement to malaria elimination, from multi-sectoral partnerships to financial innovations and a lot of fronts. And the reason why we're putting this together is to actually tell the private sector, the government, the donors, and multilateral stakeholders that we can do it. If these core companies in the room, the likes of Dangote Foundation, ExxonMobil, Chevron, Nigerian breweries, Syngenta, Nigeria LNG, and a host of other companies are actually leading, doing the bits they can do from their corner, I believe that we can also join them in ensuring that we achieve our desired goal of malaria elimination. So this is a call to action to companies that have not joined the fight against malaria. For those of you that have not joined, we want to call you to join us today. And for those that are already doing what you're doing, we want you to double your efforts and ensure that we get to where we want to get to as an entity, as a unit, and and in partnership with the government and other key stakeholders. So I would just call on the companies. So at the end of the event, we're going to share with everybody in the room. Thank you all. And
Well, thank you. Please sit down, everybody. You see that I wrote and signed the forward to this document here. It's a very interesting one. And I've had the opportunity to run through it. It contains contributions from various companies. And it is something you want to sit down quietly and go through. I don't advise that you go through it only once. You have to go through it at least twice. And keep it because it's very interesting. Each one starts with a program description and then has a second chapter, a second heading under critical success factors, in which there is a good description of the activities that and contributions that came in from that particular company. It's a good inspiration for all those and a good encouragement for all those who are interested either in joining CAMA or in starting something along the similar lines. And so therefore, on behalf of the Federal Ministry of Health, on behalf of the Federal Republic of Nigeria, I hereby launch this booklet here for you all.
The opportunities, the challenges, and the lessons learned, especially from your own implementation in Nigerian breweries.
Thank you, Dr. Arolo. Okay, so Nigerian Breweries Workplace Malaria Program started about 2003, actually, as part of the rollback malaria program. Obviously, we were having it was high prevalence of malaria amongst our employee, and that resulted to affecting our productivity. So it was quite easy to get the buy-in of the management to get really serious about it. So that started pretty well, and we got the buy-in. And obviously, we need to start with awareness provision and educating our people on what we're trying to do. So that happened. It took a while. Then we started with the monthly provision of insecticides. We also give a yearly long-lasting insecticide-treated nets to all our employees as well. For experts that come around, we make provision for chemoprophylaxis for them, also for pregnant women and children less than 5 years old, and also the new babies as well. One of the challenges, obviously, we had was the knowledge, the attitude, and the beliefs about malaria. And most employees and the other beneficiaries believe that anytime they have fever, just like Dr. Akin Fajola mentioned earlier, they just think it's malaria. So when you come to the clinic and you test them with the rapid diagnostic kits and it says negative, they walk next to the next pharmacy or the next hospital and they get the 4 pluses and 3 pluses, and you're now the bad doctor and the other guy is a very good doctor. So that was a major challenge that we have. But with continuous awareness and education, I think we've been able to do a lot of reducing that. So people actually see that or they've actually taken it as part of the program and are reducing the resistance that we have of malaria. For the chemo prophylaxis, again, we have a lot of experts as well that believe that when they take these drugs, they might have issues with their liver, and they tell you you want to sign that I'm not going to. If I have a liver problem, you can take care of it and all sorts of things. So we also have to encourage them. You find that quite surprising because you believe they should know better about this, but they can be quite resistant with this problem. So and it's been a very good program.
Thank you so much, Dr. Oyewale. Before I conclude and wrap up this plenary discussion, I may want to ask one or two contributions from the audience, either question, contribution, or input. 1, 2, and 3. Yes, I'll take you first, sir.
I'm Johnson, Fabrice Johnson Olushetire, Managing Director of All Farm Nigeria Limited. All protocols duly observed. It's just a contribution towards the nutrition part of the minister's speech. I'm happy because one of the directors of Federal Ministry of Health is here, and a colleague too. During the September last year United Nations General Assembly meeting, I was opportune to be in the United Nations Health Council meeting for new innovations in New York. And a lot of presentations were made. And one of the presentations that highly interested me was that if nutrition is adequately taken care of in under 5.
Observed. My name is Sami Ogujimi. I'm the Managing Director of Codex Pharma Limited. We've been sort of involved in this malaria business for some time. I think since 2009 when I first met Dr. Arowolo. The gentleman from Shell said, made some comments, and unfortunately the Minister of State didn't have a chance to respond. I just wanted to touch a little bit on what he said, and perhaps brother from also from the Federal Ministry of Health can take that back. And there have been loads of talk about overdiagnosis, and I'm sure we're all very aware of this. And my own observation, or should I say some of the things I've learned over near these 10 years is that every patient wants closure. If a patient goes to the hospital, what the patients want, it's not a question of whether you have the illness or the disease or not. It's you'll be treated. There is a cure for whatever illness that you have. Unfortunately, with malaria, the patients still want the same thing, but the reason why the patients get tested positively, even when they are not positive, is because nobody is giving them that closure. So the patients will see the closure, the positive result for malaria as a closure for them, because if it's not malaria, no one is telling them what else that it is. And I've attended quite a few WHO meetings and stuff, and they've been talking about this particular problem, that if it's not malaria, what else is it? And no one seemed to really be addressing that the way it should be addressed, in terms of capacity building, the doctors knowing better, even the lab scientists that are doing the test, understanding that it is not fair. When you keep on testing somebody positive, we do RDTs, and we know that the incidence of malaria is not as much as people claim it is in this country. And until the data becomes something that you can trust, we won't even know whether we're making progress or not. And so that's, so we in our own company, we're trying little that we can do, you understand, around this. If it's not malaria, what else can it be? But, we're just a company, and the nation could do a lot more to help us around that regards. Thanks.
And lastly, I want to tell us we can beat malaria because we have what it takes to. Thank you so much.
Well said, Ma. Thank you so much. Research has also proven that Nigerians are really not too patient people. But today, I think that research has been proven wrong. I want to appreciate us for our time well spent and for our listening attention, rather. Distinguished ladies and gentlemen, it is on this note we want to draw the curtain for today's event.